Okay, ladies and gentlemen, welcome to Channel V.
Thank you very much for this invitation and for this meeting. I am Professor Chaussade. I am the head of the gastroenterology unit in University of Paris, and I am the president of the French Society of Endoscopy.
I'm Pinghong Zhou from Shanghai Zhongshan Hospital. It's my great honor to have a chance to join this first China and France ESD forum live stream beginning and between us for this conference. So first, I must thank Channel V to Vietcom company to provide us a good platform.
Today, I will first speak about ERBEC curriculum and the French certification. The question is to know how to be trained. That's why, when I was president of ESD, the European Society, I promoted curriculum, especially for ESD. These are all main activities of ESD. We perform research. From research, we can produce messages, guidelines, quality parameters, and from quality parameters, we organize education. So this is more or less a stream like this.
My topic is the new concepts of endoscopic minimal invasive surgery, ERBEC. So this tumor was very, very big, or longer than 30 centimeters, just along the whole esophagus. So the esophageal lumen was full of the lumen. So with ES technique, such lesion was totally successfully removed. And the weight of this lesion was 210 grams. Technique named full thickness resection was performed or was indicated for such submucous tumors. And at last, we also use some techniques, even some switching devices to close the defect after the full thickness resection.
Mucosa cancer. Also, mucosa cancer may have a little bit submucosal invasion. Also, deep invasive submucosal cancer. This is advanced. This one is the video just finished. It's maybe it's the previous week with a weeding knife. So this one is gastric fundic gland type early gastric cancer. It's located in the less curvature of the gastric body. First, it says with a magnified endoscopy to show the border clear and marks the lesion. Then tend towards the therapeutic type of endoscope. This one also have the lesion in the laryngeal area. We just get a biopsy and get a final diagnosis. So next is some mucosal injection and circumferential resection with a video knife.
You show us a new knife.
Yes.
We don't know this knife.
Video knife.
In front. Yeah. Can you explain the characteristics related to this knife? Personally, I use a dual knife, or for example, because I'm used to. Okay, but nevertheless, can you explain?
Yeah. So just like the dual knife has the function that there's a water injection. So it's the same for the video knife. It's have the function of the dissection as well as the function of the water injection. So it's very convenient to perform ESD because if have no function of the water injection, we just remove the the knife and change for the needle. It's very inconvenient. I think this is the most convenience is accessory is for us.
One question for Dr. Li. So for the winged knife, you use it for the gastric palm. Do you find any advantage in the esophagus?
With the video knife?
Yeah.
Yeah.
How about you use it in the esophageal cancer?
Yeah. Sometimes I also use it. It's I think it's a convenience just to avoid exchange for the devices. It's very useful. It's
so
also
you mean the video knife also have the water jet during the procedure?
Yes.
And how about extra during the procedure? 交加怎么情况？交加的情况怎么样？
Scars, yeah. Yeah. So as maybe so if some lesions have very severe fibrosis or severe scars, so it's very difficult to just separate the submucosal layer and the muscle layer. So use this kind of knife just because we use the needle injection. So there's elevation, disappear very quickly. With this knife, it helps a lot, for some very severe fibrosis lesions. Yeah.
Actually, this is the first time between us, France and China on the ESD field. So maybe in the future, we can choose some special issue, not only in the ESD field, but also I think ERCP, US, and so on. Maybe next time we can focus on the pancreatic lesions, including ERCP or US, maybe in some other issues.
Yes.
I think this is a good beginning between us.
Exactly. Or screening. Screening is also.
Yes. So I think just based on the channel V, in the future, we can do some other interesting or some other challenging, some other interesting issues. Just I think such issue, such style is very helpful for us.